Hi, I'm Ashley from Steppin' Up Physical Therapy, and I'm here to talk to you about headaches. Most people don't realize that physical therapy can actually help with headaches, but it's often the tight muscles in your upper back, your neck, and actually at the base of your head that cause these headaches to begin in the first place. There can be some involvement from nerves and joints in the area as well, but as a physical therapist, we talk with our patients when they first come in to do an evaluation, and we look at their muscles, their joints, their nerves to try to figure out if that's what's causing those headaches to occur. We also talk a little bit about their diet and maybe their stress levels and their water intake, because those could actually contribute to headaches too. So when we see a patient and we're looking at these nerves and these muscles, we're trying to figure out what muscles could be contributing to the headaches. So when we're talking about muscles, how would muscles cause pain in the head? That seems strange. But what happens is when your muscles get tight, they actually can develop knots, or what we call trigger points, that then send pain into the head. So when we're talking about trigger points are knots in the muscle that cause pain to radiate into other areas. And these areas are usually predictable patterns. So let's talk about your upper trap muscle. Your upper trap is across the top of your shoulder, and that's a muscle that could cause headaches. So this muscle, if this trigger point causes pain to radiate into your head, it typically follows what we call a ram's horn type of pattern. And that's because it resembles a ram's horn. It kind of follows a C-shaped pattern around the side of the head. So if I have a trigger point in my upper trap, then I may have a headache and somewhere in that area of my head. And then there's other muscles in your neck and your upper back that also send pain into the head into these predictable patterns. So if I have a patient come to me and they tell me they consistently have pain in a certain spot in their head, I can usually use that information to determine what muscle or groups of muscles could be causing their headache in the first place. Once we figure out what muscles are involved, then we can use our physical therapy treatments to then make the pain better. So that's how the muscles cause the pain to radiate into the head, but what causes the muscle to become tight in the first place? It could be a direct injury to the area. So if you're in a car accident and you have a whiplash type of injury, that's a direct injury to the neck and the muscles in the neck. And so when those muscles become injured, their response is to tighten up, and then that could cause those knots and those trigger points to develop and then send the pain into the head. But it's not always something so obvious. It could be just sitting with poor posture for long periods of time. So many of us are guilty of sitting with poor posture throughout the day, especially if we have a desk type of job where we're sitting at a computer all day long. When we're sitting in that slouched, slumped posture, it causes the muscles in our neck and our upper back to become tight. And that's because when we're sitting slouched, the muscles in the back of your neck and your upper back, they actually have to work. They have to be turned on to hold our head upright. And so if we didn't have those muscles and we were sitting in that slouched posture, gravity would just pull our head forward. So our muscles have to work, whether you know it or not, they're working to hold your head upright. And when they work that long and that hard, it makes them tense, and then they develop those knots and trigger points that send pain into the head. So we've talked about how the muscles send pain into the head. We've talked about why the muscles get tight in the first place. But if you're having these headaches and you think they're coming from tight muscles, what can you do about it? So like I mentioned earlier, a lot of people don't realize that physical therapy is an option. In physical therapy, we can do stretches and exercises to target these tight muscles and get them to relax. Sometimes we do hands-on work, massage work, trigger point and dry needling, those types of things to get rid of those knots that are already there. But you can actually try some things at home first to see if you're able to make some progress on your own. And attached to the website where you clicked on the link to get to this video, there's also a link for home exercise programs. And I've developed a program specifically for headaches, and you can click on that link and download the exercise program, print it off, give the exercises a try, and see if you're able to make some progress on your own. If not, if you're not able to get your symptoms under control, maybe you feel like you need some more guidance, or maybe you just need to get in and have us get our hands on you and do some of that massage work or the trigger point dry needling, we'd be happy to help. So like I said, try the exercises, see if you're able to make some progress, but if you want to get in and see somebody one-on-one, we'd be happy to schedule an evaluation at one of our clinics. Just give us a call at Steppin' Up. Our number is 260-497-7191, and we'd be happy to schedule an individualized one-on-one session with one of our physical therapists. Thank you.